I'm AJ from Hipporoo, and today I'm going to be showing you position number 4. Please remember, position number 4 through to 10 are only suitable for babies that are 6 months and older, preferably older than that. So you need to, and it really depends on your baby, you need to see that your baby is able to sit upright and support their head unassisted prior to using any of these positions. Position number 4 is you're just going to use your top piece carrier. So you're just going to take your carrier, place it in the position like position number 2. Step 2, lay your top carrier piece on a bed or a compactor. Take your baby, support their head, and you're just going to place them in the groove here where you have better head support. So place your baby down, lift either leg on either side and strap them in the carrier, and simply tighten the waist straps. Okay, again, not too tightly. You want to leave a finger space between the actual waist strap and the material. You sit your baby up because they are already sitting. Then you're going to face backward towards your baby. Take your straps on either side and then just click it into place. And I can feel that they're fine back there. And then very simply lift my baby up. And as you can see, again, they're nicely seated at the back, and I can just adjust the waist straps if I still need to. But my baby's nice and supported, so I can go for a walk in the back carrying position without hip seats. Position number 4. Remember please that this position is only suitable for babies that are able to support their head unassisted. Please do not use this position with your baby until such a time. So it's quite simple. I'm going to do the same steps that I did for position number 2, which I showed you with a view from above. I'm going to strap my baby in on either side, and then I'm just going to cusp them up into a sitting position, put the carrier over my head, reach back for the buckles and clip them into place on either side, like this, and there you have it. I can go for a walk with my baby without the hip seat, and the bottom will be fully supported up until the knee joint. You can see it's quite wide here at the bottom for them. If your baby's legs are tending to droop downward, you need to reinforce it with an extra piece of material. You can use a scarf, etc. You can just flip it inside here and just leverage it up and tie a knot at the back. Position number 4, outward facing. Okay, again, this is not the best position from an ergonomic perspective, but also from just a general sensory perspective for your baby. It can cause over-stimulation. So, you know your baby best. Decide what is best for your baby and yourself, but it is a possibility with the Hipporoo Carrier. So you're just going to take your baby like this. You're going to strap your carrier already on either side, loosen the waist straps, support your baby's head, lower them into the carrier, the bottom first, so lower their feet into the carrier on either side. Put their feet on either side, facing outward like this, and then you're just simply going to pull the waist straps on either side, show that they are supported, and you can put their arms out to face the wall, and there you go.